Hi, my name is Davin Lim. I'm a board-certified dermatologist practicing in Australia. First of all, melasma is a unique disorder. Even though we know much about melasma, there's still so much to learn. One of the rate-limiting factors is, of course, sun and UV exposure, which is ubiquitous around us, and thus it makes it very hard to treat. The PicoShot Pro really has revolutionized melasma treatment for us. The reason being is that it produces an immense amount of energy in short packets of time. What this means is that it can deliver a significant amount of energy without peaking, and thus it can clear up melasma very quickly compared to traditional lasers. Well, I guess the most important thing is to explore the amount of sunscreen that you're using. To me, that's the most important bit. Secondly, we can consider using special tyrosinase inhibitors, in other words, pigment correctors, of which the ideal type will be chosen by your dermatologist. And thirdly, we often use picosecond lasers to help remodel the skin in special settings. The most important thing is to understand the biology of skin. The first thing to do is to ensure that the patient is well photoprotected. Thereafter, the use of exact settings or parameters as dictated by your clinician would ensure that your treatment is both safe and effective. So the Potenza system by Cynosure is unique because it delivers two things which help with melasma. Firstly, it remodels the deeper layers of skin, or the dermis. Secondly, it can deliver actives with its fusion tip. This ensures that the actives belong in the deeper layers of skin instead of being wasted on the upper layers of skin. Melasma is often the clinical diagnosis. In most cases, we can make the diagnosis without a biopsy. There are certain patterns of melasma, together with a history, which makes this a standout form of pigmentation. If we're in doubt, dermatologists may often take a tiny piece of skin, known as a biopsy, for further examination. The most important is the adequate use of sun protection. To me, that's paramount. Secondly, is to decrease the amount of heat that your skin is getting. Thirdly, is to understand for some cases of melasma, we need to incorporate the anti-aging benefits of topicals, injectables, and energy-based devices to ensure that we have a longer time of remission. This is difficult. For patients with acne or acne rosacea and melasma, the first thing to do is to establish the skin barrier function. This often means treating the skin itself and preparing itself for melasma treatments. I think now we understand the fundamental causes of melasma, and for me, it's a combination of key energy devices. For example, if we're using pico lasers, we can help to treat pigment, whilst if we're using other modalities such as radiofrequency microneedling, we look at the dermal aspect, therefore increasing the remission rate of melasma itself. We understand that vascular factors play an important role in the etiology of melasma. Close dermatoscopic examination will reveal the clinical findings. I do believe that the first-line treatment is probably with tranexamic acid. When we use T-acid, we can use it topically, or in my preference, orally. Other things that we can use include energy-based devices, such as lasers, to treat the vascularity. Guys, I thank SpectraMed for organizing this. I'm really impressed with this company. It's a cutting-edge technology company, always looking at the horizon for new treatments. So thank you very much for asking me to be involved in this year's symposium.